Hello everybody, today we are here to discuss the egg and woman. We all know that women will be having a reservoir of eggs from the time they have born, and at the age of 13 years it will be around 5 to 7 millions, but it lasts up to a age of around 35, and following which it will be deteriorating slowly. So now many of the women's, the eggs will be deteriorated much earlier, maybe at the age of 25, 30 also they will have a very low quality eggs. Now every woman will have one question in their mind, whether we can improve our egg quality or not. Now we have to know the reasons why the egg quality gets poorer in women. The first and the foremost, we have to find out from the history. We can find out from the history that if the woman's mother or the mother's sisters or even the relatives, they have a early menopause, so they are the very much prone people who will have a decreased egg quality and they will lose their eggs very fast. Second is many of the reasons, like the age is the most important factors. Previously we used to know that following 35 years the egg quality deteriorates. Now we are saying even after 30 also the egg quality is deteriorating fast. So we have to do a ultrasound or the TVS to find out on the second day how many eggs that we can see, and there are a couple of tests that also can tell us that yes, how many eggs the woman is already having, or what is the chances that she will have a long time association and she can try naturally or otherwise. The next thing, the reasons for which the egg will be deteriorated, it is a lot of genetic factors. So as I mentioned, in the history level it can be find out from the mothers or the mother's sisters. So it is a genetically designed that who will have a more egg or who will have a less egg. Now there is a ethnic difference also. Many of the studies has found out that Caucasians will have a more eggs, so they at the age of 35 the quality of egg they give is much better than the egg quality of the Southeast Asian or the Indian community of the woman. So naturally the genetic factors also come a very big role, play a very big role in the cases of egg quality. Now next, the nutritional factors. A woman with a proper nutrition will have a much better egg than the woman with a very poor nutrition. So India, we have seen the low socio-economic conditions where the prevalence of tuberculosis or many other diseases, so they will have a much poor quality of eggs and they will lose their eggs very fast than a woman with a proper nutrition. So then there is any kind of toxins, so environmental toxins if you are exposed to. So like today's we see that because of the pollution, the air pollutions, many of the toxins that also can reduce the egg numbers very much. Then the stress factor is enormous to reduce the egg. So it's a stress in the family, stress in the workplace, night out, night work. So all these things are very much related with a decreased number of eggs. Then addiction, the alcohol, smoking, they also have a huge role in reducing the number of eggs. Then there are ovarian condition, that the ovary has to be healthy. So healthy means if the ovary is having a endometriosis, so grade 3, grade 4 endometriosis, they will have a very poor count of eggs. So overall egg is very important. Egg quality cannot be improved, it is predestined. So women, whoever will have how many eggs is already decided. Only we have to identify the woman who can have the better fertile life and how many eggs, how many days of eggs they can be having it.